Okay, so here's my title slide. All states of mind are workable. Mindfulness practice and contemplative psychotherapy in recovery from bipolar disorder. And I think I have about 84 slides, and my aim is to do this in about 45 minutes. I might go a little bit over, but if you want to keep track of where we're at, the slide numbers are in the bottom out of a total of 84. Okay, so this is a little roadmap of the whole structure of this presentation. So at major turning points, this agenda will come up again, just to let us know and delineate our progress throughout the presentation. And before the introduction, I just wanted to share the overall findings up front, in case you can only attend the first 5 minutes. And then before that, I need to give you some abbreviations because they're in the next slide. So the abbreviations I'm using in this dissertation are BD for bipolar disorder, CP for contemplative psychotherapy, and then a few times I mentioned MBSR, mindfulness-based stress reduction, and MBCT, mindfulness-based cognitive therapy. So the big overview. The summary of my findings is that recovery from bipolar disorder is possible. And a helpful way of understanding that is as integrating self and experience, self within self, experience within experience, and bringing everything together rather than being fragmented, integrated, and whole. And that process of integration is supported by a flexible and personalized set of interconnected mindfulness practices, interconnected wellness practices, including mindfulness practice. I thought that mindfulness practice was going to be like the key element, the center of the whole design. And it's really important, but in fact, it's contextualized by all of these other practices. So mindfulness catalyzes recovery and crystallizes that process of integration and helps cultivate these attitudes of orienting towards experience and befriending it. So those are some of the key findings. And then finally, contemplative psychotherapy, which I also introduce and discuss in this presentation, can help to inform a new approach to recovery from bipolar disorder, drawing on its practices and principles, okay? So that's the big overview and the big takeaway. And at the end, I'll tell you more about all of these conclusions. So in terms of introducing the topic, I thought it would be helpful to tell you all a little bit about myself and how I got to this topic. Basically, in my early 20s, I had mood difficulties and it was diagnosed as bipolar disorder. And I worked with a psychiatrist and some other prescribers, and I read as much as I could find on the topic, but the Western approaches available at that time were not satisfactory to me. They basically said, take pills and hope for the best for the rest of your life. And I wasn't really into that. So I sought out complementary and alternative approaches to healing and recovery. And I was introduced to mindfulness practice. Actually, I was introduced to the nature of mind by a psychologist in his office in Milwaukee, Wisconsin, back in the early aughts. And I had this sudden glimpse that was really transformative. It gave me a direct experience of something I'd been feeling was missing from my life for a long time. And based on that, I went off my medication in 2004, and I've been stable since then. You know, I have been subclinical. I don't really count myself as having bipolar disorder anymore. And for me, the recovery process included pursuing mindfulness practice and Buddhist study. And then based on that, vowing to create an approach to help other people. So this presentation and this whole dissertation process is the fruit of that wish to be able to come up with something that could help others. And as part of that training, I went to Naropa University and did a master's degree in contemplative psychotherapy. And then here we are in East-West psychology at CIIS in San Francisco. So that's my story and how I got here. And now I'd like to contextualize the problem of bipolar disorder a little bit. These are typical academic moves saying, what's the problem, what's the issue, and how does this research relate to the problem at hand? So bipolar disorder, as you probably know, is a really difficult mental health diagnosis characterized by ups and downs, extreme mood swings, and behavioral changes that go along with that. And it affects between 1% and 5% of people worldwide during their lifetimes, depending on how you want to define bipolar disorder. And in addition to that, it's actually the costliest mental health diagnosis in the United States. It's more costly compared to schizophrenia, compared to depression, compared to all of these things. And there's a lot of money and mental health challenge that goes into supporting people and having a good life. And the mainstream treatment, which is a combination of pharmacological treatment and psychosocial treatments, is effective in preventing mood relapse in 25% of patients in the STEP-BD trial. Half the people never achieved mood relapse, and the ones that did, at follow-up, only half of those were stable. So even though we have a lot of medication and a lot of psychosocial treatments, there's really a need for more to improve functional outcomes and to address other dimensions of wellness other than just disease remission and symptom reduction. And another really interesting thing about bipolar disorder is that the functional outcomes are highly variable. Some people end up being disabled for their entire lifetimes and needing a lot of social support. And some people have bipolar disorder, but they're able to thrive. There's this whole spectrum of wellness. And part of what I got interested in too was finding ways to support different people in terms of different outcomes and having a recovery approach that could be applicable across the spectrum of outcomes. Right? So these are some of the ways that I conceptualize bipolar disorder and say there's clearly a problem that we need to address here. Okay. And because of my orientation to mindfulness and this increasing interest in the West in mindfulness practice in terms of working with mental health disorders, I thought, well, what if we take mindfulness and apply it to bipolar disorder? Well, of course, I'm not the first person to think of that. Other folks have tried it before. And in particular, MBCT and MBSR have been adapted to use with bipolar disorder. MBSR is the first big validated clinical intervention. And its mindfulness practices that were kind of abstracted from these traditional Buddhist techniques and repackaged in a secularized format were then adapted, those practices were taken from MBSR and then put into MBCT for depression by kind of joining it with cognitive therapy. And then they tested that with lots and lots of people and they found out, hey, this actually helps some people work with depression. So those same interventions have been tested with BD and there's some early promise. However, in some meta-analyses of like looking at the studies of studies, what they found was that there's a need for better evidence. There's a need for better designed trials with like more kind of rigorous quantitative analysis. And there's also a need for larger sample sizes. So the initial research is promising, but as yet it's inconclusive. And my contention is that MBSR was designed for chronic pain and MBCT was designed for depression, right? And if you think about bipolar disorder, well, bipolar disorder is only kind of half depression. The other half is mania and hypomania, if you think about it in that way. So rather than taking these things that were created for something else and adapting them to bipolar disorder, why don't we just build something from the ground up for bipolar disorder? And that might actually be more effective in terms of treatment outcomes. So that's another of my contentions, another place where this research could have a meaningful impact and create new knowledge and new treatments. And I talked a little bit about the way that MBSR and MBCT abstract the mindfulness practices from their traditional cultural trappings. So, there are some scholars who think that if you take mindfulness practice out of a Buddhist cultural and ethical context and like conceptual context, you lose some of the special sauce. You lose some of what makes it effective, right? And I think that might be true. That might be true for some people. And I think that in particular for bipolar disorder, Buddhism has materials that can help people understand their experience and shift in their understanding in ways that are really skillful. It can help people approach their experience with benevolence and openness and with the conviction that they're basically sane and that things will all work out in the end, or, stuff like that. So my contention here is not that Buddhist mindfulness practice is better than secular mindfulness practice. Rather, for some people with bipolar disorder, Buddhist-informed mindfulness practice could be more effective in terms of recovery than secular approaches. And likewise, some people might benefit more from secular approaches. But there's a special space in the field for a Buddhist-informed approach to recovery from bipolar disorder that has not been addressed. And that's another place where this research can stand to contribute. Okay. Another really important conceptual piece and theoretical piece that goes into this research is all of the literature on recovery, right? So, basically the Western field of psychology/psychiatry was instituted in the 20th century with Freud and Wundt and those folks, right? And has developed into more advanced like mental health treatment disciplines with more like canonical forms and like normalization and research studies and stuff like that. And so that's one main discourse stream in working with mental health is psychiatry and psychology. And along the way, there have been these other community-based approaches to wellness that have sprung up that rely less on diagnosis and treatment, that rely less on pathology, and that critique and respond to some of the historical power abuses perpetrated by psychiatry. Psychiatry has not always been kind to people that it has diagnosed. Psychiatry has liked to lock people up in asylums and give them coercive pharmaceutical treatment and give them coercive shock therapy treatments and things like that, things that are really damaging and traumatizing for people. And I've met people who've had those sort of coercive psychiatric experiences who felt that the treatments themselves were worse than the thing they were purporting to cure, right? So there's been this whole consumer, survivor, ex-patient movement, and also this whole anti-psychiatry movement. They have some overlap and also some differences, but that have fought for definitions of recovery that are inclusive of multiple outcomes of recovery. So part of what I've done in this study is deliberately included those multiple dimensions. The second point mentions some of them: staying well, personal recovery, quality of life, and social empowerment as meaningful outcomes for recovery from bipolar disorder. And I wanted to make sure that I built that in and designed it in, again, so that people along a wide spectrum of functional outcomes can have a meaningful approach to working with their state of mind, okay? And then finally, as part of the introduction, I have a few slides talking about the design of the dissertation. So this dissertation was designed as a multi-paper dissertation. I published one paper that's in the dissertation. One of them is accepted for publication, and the third one is accepted or is in the peer review process. So that adds to the outcomes, the publishable outcomes of this project. There's also a data set that's been uploaded to a repository, which includes the transcripts and some of the analysis from this dissertation. And what I found out is if you're writing a multi-paper dissertation with like a kind of complicated research design, you probably have created enough work for yourself to take up 3 dissertations. So here we are at my really complicated, hopefully not long-winded, hopefully still interesting dissertation presentation. But so that's the design, and it'll show forth in the kind of the 3-stage format that I talk about soon. These are the citations, if you're interested, from those works, those articles and data sets that I mentioned earlier. And so the overall study design works like this. You could call it a theoretical hermeneutic qualitative approach. Basically, I wanted to create an integrative treatment approach, which is the fruit, the third step you see here, the red apple, right? And in order to create that approach, I wanted to interview people who knew about recovery from bipolar disorder. I thought, why not ask the experts who know about using mindfulness, Buddhist-informed mindfulness practice to recover from bipolar disorder? And those are the qualitative findings with the little orange book there, okay? And then I was like, I'm gonna need to interpret those findings in some way. And so that's the lens, the blue magnifying glass. So contemplative psychotherapy is the lens through which I interpret the qualitative study findings, the text, yielding the fruit of the integrative treatment approach. And that's all on the roadmap, and we'll just walk through it together. So it won't be too complicated, I hope, but sometimes making new and creative things requires complicated moves, I guess. So the lens, the theory-based contemplative psychotherapy. So this slide shows the crest of contemplative psychotherapy, the Naropa tradition of contemplative psychotherapy, which appeared on their journal, which was published from 1980 to 1994. And it's got this arc that says brilliant sanity over top. And then there's a Bodhi leaf outline, which is a symbol of like the tree that the historical Buddha attained enlightenment under. And then there's the wheel, which represents both swift motion, connecting, and the Eightfold Noble Path. Okay, so this is the contemplative psychotherapy communication, the iconic communication about it. And Naropa University is a school in Boulder, Colorado. They first offered a contemplative psychotherapy degree in 1976. And they have this really innovative and immersive training program that includes clinical training in psychotherapy along with Buddhist psychology coursework and meditation retreats that are an integrative part of the program. So it really is a way of including clinician mindfulness in clinical training from the outset and using Buddhist psychological lenses to clarify and reinforce those teachings about the nature of mind so that people can bring them into the therapeutic relationship and make them be effective there. The program has also, as I mentioned, published an academic journal in the past. Several books have come out of that program. There's a Karuna training certificate program that has come out of that program. And there are other traditions of contemplative psychotherapy in the world. I'm just focusing on the Naropa tradition because I know it best, okay? And in this paper, I gave an overview of the core theories, practices, and then some of the other theories of contemplative psychotherapy. And then I talk a little bit about the common factors and the import of contemplative psychotherapy with the common factors. So the core theories that I outlined, I didn't make up the core theories, I'm just articulating them in this academic context. I've thought maybe the three core theories of contemplative psychotherapy are brilliant sanity, which is the notion that one's basic state of mind is indestructibly good, wakeful, and available. And confusion happens, but it's incidental. It's like clouds covering the sun. The sun is always there. Brilliant sanity is always there, even if confusion temporarily obscures it, okay? The second core theory of contemplative psychotherapy is maitri, or unconditional friendliness. Basically the notion that by turning towards experience with acceptance, interest, and an absence of judgment, it becomes possible to be in direct relationship to self and experience in a way that is healing and profound. And in contemplative psychotherapy, the therapist learning to do that for themselves means that they're able to do that for clients. And for clients, it feels really good to be accepted unconditionally, and then to learn to cultivate that same attitude towards oneself and one's experience. And then the third core theory of contemplative psychotherapy is exchange, which is the notion that human beings can subtly communicate states of mind and experience to each other without words, without symbols. There's something about mutual dyadic communication that happens that can be really wholesome and good. And contemplative psychotherapy uses this phenomenon to therapeutic effect by subtly communicating maitri and brilliant sanity to clients. And then the core practices of contemplative psychotherapy should include sitting meditation, mindfulness awareness practice as the foundation of clinical training, and a way of getting in touch with the therapist's brilliant sanity as well as the client's brilliant sanity. And then other contemplative practices to strengthen qualities and characteristics that make for good therapy and that help therapists identify brilliant sanity in all kinds of different states of mind. So there are multiple different contemplative practices, some of which are unique to contemplative psychotherapy. And then finally, I laid out contemplative psychotherapy's interventions, most of which center around helping clients identify and align with their brilliant sanity. And contemplative psychotherapy has a few unique techniques. It also is happy to draw on multiple theoretical orientations to do whatever works for a given client at a given point in time. And then in terms of other contemplative psychotherapy theories, some important ones include Buddhist frameworks. Buddhism has a lot of psychological, philosophical, and phenomenological frameworks, many of which can contextualize and actualize mindfulness practice to inform it in a new way, just like giving a person a microscope with the biology book helps them to understand how to use the microscope better and discover new things. Contemplative psychotherapy also includes Western psychological theories, including humanistic counseling theory, and it also embraces transpersonal realms of psychotherapy, aspects of behaviorism, aspects of psychodynamic schools. There's really a willingness to embrace lots of theoretical orientations while maintaining a central emphasis on mindfulness and the contemplative psychotherapy frameworks. And then finally, contemplative psychotherapy includes the Windhorse model, which is a program for recovery from extreme states, such as what is sometimes diagnosed as schizophrenia or bipolar 1, or all kinds of things that can be in the kind of severe and persistent mental illness spectrum. But Windhorse creates a home-like environment for recovery and provides cues to help individuals in such states identify and align with their brilliant sanity. So rather than being a coercive experience where they're, so to speak, locked up with other people who aren't well, Windhorse takes people who are having these sorts of difficulties and surrounds them with people who are in touch with brilliant sanity so that they can be included in a communicative and supportive community framework. So there's a lot that that goes into enhancing wellness for people with those situations. And those are also other things to draw on later on down the road when I talk about the integrative treatment approach. Contemplative psychotherapy uses mindfulness practice to contextualize and connect the main theoretical aspects. So by practicing mindfulness, the clinician identifies with brilliant sanity and deepens their understanding of it, opens to the exchange, and enhances their ability to bring unconditional friendliness towards experience. So mindfulness isn't a standalone thing. It's completely interconnected and deepened by the theoretical perspectives that validate and refine it. So I think that's important to mention. And that I think also holds true later on for some of the qualitative study findings. And then finally, I argue that one of the special contributions that contemplative psychotherapy could stand to make to the wider field of psychotherapy is helping clinicians enhance their ability to deliver the common therapeutic factors. The common factors are what makes a therapist good, no matter what style of therapy they're doing. And basically it boils down to things like relationship, genuineness, unconditional regard for the client, willingness to build a collaborative treatment plan together, and mobilizing client resources are a handful of like the main common factors. So my contention is that contemplative psychotherapy training can help therapists deliver those things no matter what style or like technical interventions they're using in psychotherapy. And that said, these contentions would need to be further validated through things like outcome research. It's not enough to just say, I think it's great and it should be so. More research is needed. And so are more publications and training options. I think it would be helpful to integrate social justice and diversity issues more deeply into contemplative psychotherapy, which, like lots of psychotherapy, is historically more of a white and patriarchal phenomenon. So it'd be good to bring more of those perspectives in. And also it would be good to help Naropa contemplative psychotherapy cross-pollinate with other traditions of psychotherapy and mutually enrich each other. And then finally, it would be good to create new interventions based on contemplative psychotherapy theories and practices. So that's another way that I'm contributing to the contemplative psychotherapy field, is that the integrative treatment approach and to some extent the qualitative paper is also advancing the field and expanding contemplative psychotherapy as a field. It would be great to see more of that thing happening too. Okay. All right, so that was the lens. Next is the text. So the text is the qualitative study. And let me show you what I mean. The text, this particular text derives from interviews that I conducted with 9 individuals about their experience recovering from bipolar disorder using Buddhist informed mindfulness practice. So I interviewed them and recorded it, and then I took those recordings and transcribed them and put them in the second pane that you see with like the red underlining and stuff is the transcription and qualitative data analysis software. So I manually transcribed them all, and then I coded them, and then I created themes from the codes. And then the third pane is the big picture of all of the codes generated from the study. So I'm gonna start by showing you all of the main areas of the of the top level themes in this document. And then I'll talk about the qualitative study design and give you a little intro to qualitative research, and then I'll get into the findings in more detail. Okay, but I just wanted to give another overview so folks know what we're looking at. So this slide is the whole qualitative data analysis themes all sorted out and noted. Okay, and there are 4 main sections. The first one is mindfulness practice in that lower left quadrant. And all of these boxes and yellow bars that you see are going to be replicated in the findings section later on, okay, and textually. And then the second main area of my findings was other wellness practices that people used in their recoveries. You'll see this later on represented as the matrix of wellness, okay. The third main section of the findings was principles of recovery. And again, these 4 boxes that you see inside this box will be broken out. And you can just see how much granular detail actually goes into each of these topics. I'm not going to present at this level of detail, but there's a lot. There's a lot into it. There are about 1,000 individual codes on this board. And then the fourth main one is the lived experience of BD, which is people talking about what it was like to experience bipolar disorder. And I actually didn't include those reports in the findings, because basically they say it was like this, mania was like this, depression was like this, psychiatric treatment was like this. And it basically substantiates, yes, these people did have something that falls within the domain of bipolar disorder. And then there's some unsorted codes that are here because I coded them, but then I didn't do anything with them. So those are also not reported, okay? And so again, in the findings, I dropped out the lived experience. So these are the 3 main top level findings I'm gonna show you later on, but I just wanted to give an overview preview so people know what we're getting into, okay? So I wanted to say a little bit about qualitative research in case people aren't familiar with qualitative research paradigms. So qualitative research is really helpful for asking about human experience, the whys and hows of life, okay? And it's also really common in early phases of social research to define the contours of a phenomenon before you can measure it quantitatively. Like a lot of research we consume is quantitative, which involves counting and numbers. Qualitative is about qualities of experience. And it partakes of other research paradigms than the kind of objective, like scientific materialistic point of view. So it includes constructivist, feminist, participatory, narrative, etc. kinds of ways of looking at reality and experience. And sample sizes fewer than 6 are relatively common in qualitative research. You know, just a few interviews can generate a lot of data, and that data can still be meaningful, even if it's not statistically generalizable in the sense that quantitative research is. So it responds to different imperatives, different parameters about quality. And so to illustrate the difference, it's like if you ask this calculator, what's the meaning of love? If you ask, why do people grieve? And if you ask, how do people recover from bipolar disorder? A calculator doesn't know anything about that, right? So the nature of the questions imply that a different research approach is needed. And these are all questions that are better served with qualitative research. Now, just because it's a different research paradigm doesn't mean that there are no measures for what counts as high quality qualitative research, right? So an example of a rubric for looking at different kinds of qualitative research that are good is Tracy's 2010 article that talks about these 8 kind of big tent characteristics of good qualitative research: worthy topic, rich rigor, sincerity, credibility, resonance, significant contribution, ethics, and meaningful coherence, right? And the metaphor that Tracy used for coming up with all of these criteria, looking at, you know, dozens of different qualitative research methods is making cheese. She says, just like experienced cheesemakers can judge the quality of very different kinds of cheese, like a blue and a brie and a cheddar, you know, and a cotija and all of these different kinds of things. They all have their qualities, but somehow they all hang together really well. So Tracy thinks that these 8 qualities are good qualities that can be easily applied to all different kinds of qualitative research. Okay. Okay, so that's a little bit about qualitative research. Here's my particular study. This is just an overview of the next section. I started with the research questions. How do people use mindfulness meditation and Buddhist psychology and philosophy to recover from bipolar disorder? And then I asked, what are the effects and impacts that people have experienced while using such an approach? I really wanted to know what works and what it's like. Okay. I included some definitions because it's always really important to operationalize what you're asking about. So these are just the canonical definitions that I applied for the purposes of this research. And I identified 5 kinds of recovery that I wanted to make sure to include. They were the typical psychiatric ones of symptom reduction and disease remission. I also included improved quality of life, psychosocial adjustment, or like learning to live with bipolar disorder, and social empowerment, or having a meaningful social role other than a mental patient, as the 5 kinds of recovery for this study. And another important thing in qualitative research is to include researcher reflexivity to talk about the ways that the researcher's positionality informs how they interpret and work with the research. So because I have a personal experience of this phenomenon, clearly I have the potential to kind of bias the views and just recapitulate my own understandings. In order to counter that, I tried really hard to stay with the experience of the participants as expressed in their words. And both during the interviews and during the analysis, I tried to refrain from imposing my own meanings by bracketing and noting and making sure that I wasn't asking leading questions and things like that. And I can also say that over the course of the last 8 or 10 years, I've come to a really different stance with Buddhism. I used to be a much more like, I don't know, religious Buddhist, or I had a lot of belief and a lot of like personal need to engage with the tradition. Right now, I'm more at a place of respecting the Buddhist tradition, but being a little bit agnostic. Like it's not the end all and be all for me anymore. And my question is more not like, how can we help more people find Buddhist salvation or whatever, but more, can we take Buddhist cultural materials and make them useful to people in the current context to reduce their suffering? So in a sense, based on my new positionality, in terms of relating to the research data, there's been a shift in frame and a shift in the chance that I'm likely to bias what it is that I'm talking about. So those are my reflexive reflections on this study. Okay, so this is the recruitment poster that I made to bring people along. These are the screening criteria. They had to be adults diagnosed with bipolar disorder at least a year ago. They needed to have experienced at least one of the 5 kinds of recovery and practice mindfulness meditation at least 45 minutes a week during one 6-month period in the 2 years leading up to the study. They needed to have learned meditation from an experienced teacher. Whether that was in person or in a book or in a video, it didn't really matter to me, but that was like the Buddhist link, to call it Buddhist informed, and they had to have used Buddhist ideas in their recovery. And to prevent the risk of harm, people were screened out if they had experienced major depression, psychosis, or suicidality in the last 6 months. Additionally, participants needed to submit a signed attestation from a psychiatrist saying that they had met criteria for bipolar disorder in the past and were presently stable enough to participate safely in the study. Okay. So that was the eye of the needle. I was worried I wouldn't be able to recruit the people, but then I did. And that was really great. 15 people filled in an online screening form. Of those 15, 10 of them completed the main interview, and then 1 person dropped out after the main interview, but before the verification interview. So you can see the participant demographic table explains a little bit about the participants and then talks about the 5 kinds of recovery that they did or didn't experience on the right-hand side. Ethical clearance was granted by the institutional review board at CIIS to make sure I wasn't going to harm the folks who were in the study. And like I said, there was a main interview and a phone verification interview, and then I manually transcribed the recordings in computer software, and then I did coding and thematic analysis. And so the next slides explain more about the research method and how that worked. So these are the phases of thematic analysis that I followed. Basically, you expose yourself to the data by reading the transcripts and maybe transcribing them. You start generating codes of like highlighting an area and being like, oh, this reminds me of this reminds me of that. this is a good way to synopsize this section of text. And then you start searching for themes, and over time refining the themes, defining them and naming them until they all fit together. And then finally you produce the report. So I interviewed the people. Like I said, there were main interviews in person and via phone and video conference. And then I also did a phone verification interview afterwards. And then after having gotten the recordings in the digital recorder, I took the recorder, I plugged it into my computer, and then I manually transcribed it in the transcription software using a keyboard and a transcription pedal. And then I started to highlight and code the various sections. So this software that I used, F4 Analyze, is really cool. You can do different colors. You can make subordinate codes that belong to another code. It's really flexible and cool. You can click around and search and find things. It's pretty cheap as these things go, and was really good for my project. So I highlighted the sections in each transcript, and then on the right-hand side, the themes appear and can be sorted hierarchically. Now, I took those themes that I generated, and my next step was to put them in a piece of software called Scapel, which is a visual storyboarding software, initially made for writing, but it worked really well for this. And I started to sort the different themes out into piles. I was like, this is kind of the pile related to how people meditated. This is the pile related to benefits that they found and stuff like that. I sorted them into piles, and gradually over time, I refined the piles more clearly into themes that I later on named, right? So it was this ongoing process of refinement and clarification that unfolded over months, really. And then over time, I defined the themes and sorted out the structure of things. I defined connections. It became clear how different things were connected to each other. And that's basically the process. And then this process and this kind of diagram is what you saw at the beginning of this section, the big map with 1,000 codes, okay? So that's how the analysis worked. And here are the findings. So like I said, there were 3 top-level themes that I'm going to present on: mindfulness, other wellness practices, and principles of recovery. So first, mindfulness. In mindfulness, there were some sub-themes. I noticed effects of mindfulness. People talked about the traditions that they practiced in, and they also talked about the practices that they used, the specific mindfulness practices. So among effects, there were lots of benefits that people reported. There were also a few drawbacks. One of the top-level themes of the benefits was building capacity for health. People ended up describing how they built a foundation for health. They cultivated resilience. They found ways to end bipolar patterns that were creating problems in their lives. Some people felt that there were medical benefits, and they also talked about positive life outcomes. And so just to say it again and to clarify, all of these top-level themes of building capacity for health, emotion regulation, et cetera, had convergence in the accounts of at least 3 participants. The same is true of all of the fragments of these points that I'm listing, with the exception of the last one, right? So building a foundation. At least 3 people said something like, mindfulness helped me build a foundation in my life, okay? So the second sub-theme of emotion regulation, people reported that they gained in emotional self-awareness and resilience, that they experienced positive emotional changes, and that they experienced emotional freedom and reduced reactivity. They were less liable to be thrown about by their moods, basically. The next one is shift in experiential perspective. This included getting more acceptance and transformation. They had improved cognitive clarity. They became more embodied, and they learned how to integrate mindfulness with their experience. Mindfulness isn't that helpful if it's just something you get on the cushion. You have to weave it into your life for it to really bear fruit. And then the fourth high-level theme here, adverse effects. Participants did mention a few adverse effects that they experienced along the way. One person talked about hyperventilating. Another person had a panic attack during mindfulness practice. Another person had a lot of pain. In general, what people did when these adverse effects happened is they either kept on practicing and the problem went away, or they learned how to adapt their practice and that solved the problem, all right? In terms of mindfulness traditions, what I found was that people practiced in a whole bunch of different traditions, and their practice path moved them through different traditions over time, so that they, in effect, had a really individualized and eclectic approach to meditation practice, where they were able to draw on different practices that they needed from different times in their life to respond to conditions now. And then I also found that people used a lot of different mindfulness practices. On one hand, there were lots of different individual sitting meditation techniques. Sitting meditation was not a single unitary technique. People could focus on their breath, they could focus on their body, they could focus on their emotions, they could focus on their sensations, they could focus on their thoughts. There were all kinds of supports and objects and different techniques to work with those objects. People also used a whole bunch of different other practices in their recovery paths. They used generative practices, which included visualization, devotional practices, and cultivating adaptive emotions, such as through metta practice and Tonglen and self-compassion. They also practiced embodiment practices and investigative practices. So it wasn't just sitting meditation. There were a whole bunch of other things that they used. And they implemented practice by having a routine meditation practice that helped them to have regularity in their life. And they adapted mindfulness techniques to their needs. It wasn't some canonical one-size-fits-all thing. They were really helpful in a craft approach to mindfulness that's personalized and evolved over time. And finally, people used informal practice in daily life. That was really important for making it available in all moments and in working with different mood problems. And then people also used other wellness practices, therapy and healing, social support, spiritual practice, skillful conduct, supportive ideas, emotional balance, and caring for the body. All of these practices were important, and people emphasized different practices at different times based on their conditions. And what I found was that mindfulness practice really had an overall effect of integrating self and experience. It integrated with all of the other wellness practices. And in fact, the overall logic of recovery was integrating self and experience. It was at once a principle of recovery, a process of recovery, and an outcome of recovery. And mindfulness practice wasn't always the most important practice for people, but I found that it informed and crystallized all of the skillful, personalized pathways to recovery. Because people had more self-awareness, they knew which other practices to use at different times. And that could include doing more mindfulness practice or choosing to do something else, and maybe to do it mindfully. And then the third top-level theme of my findings, I'm noticing I'm running a little bit slower than I thought. I'm at about 40 minutes, so I'm going to start to speed up a little bit here. But in terms of principles of recovery, there were 4 top-level themes of meaning of recovery, recommendations for others, emergent principles of recovery, and pith instructions. The first 2 of these I elicited directly through questions in the interview guide. The last 2 emerged or were identified during the analysis phase. In terms of the meaning of recovery, people felt that creating and maintaining recovery was really necessary. It was an ongoing process. Wellness outcomes, such as I don't suffer as much from bipolar disorder, or I'm able to get on with my life, were really important for people. Embracing experience was the significant meaning of recovery in this population. Being able to turn towards and work with experiences, including painful emotions, was a really important part of the meaning of recovery for people. And they also said that a life well lived was what recovery meant to them. Okay. And then in terms of recommendations for others, they had 5 recommendations for other people who might like to use mindfulness practice to recover from bipolar disorder. Open your mind and open to change, meaning be willing to be transformed in order to feel better. Be willing to get new ideas and change in terms of who you are. Caring for oneself was an important piece of advice, as was working hard and making a steady commitment. Nobody in the study said bipolar disorder is really easy to work with. They all said they had to work on it over time, day in and day out, with a steady commitment in order to be well. Folks said it was really important to build a support network of friends, family, community, and professionals in order to maintain wellness. And they also give specific advice around developing a meditation practice for recovery. There were a bunch of emergent principles that I thought could be like overall guides or heuristics for the process of recovery. And I talk about them more in the dissertation. They're listed here. And they're important, but I don't have time to get all the way into them right now. And likewise with the pith instructions. The pith instructions were kind of like the hard advice that could be like little slogans of recovery that might be helpful for other people to use in their recoveries. And it's really about turning towards the pain, working with one's situation, having space and humor, and developing a trust with basic sanity or brilliant sanity or basic goodness, and trusting there's nothing to be fixed. You just have to bring mindfulness, awareness, love, and compassion to your experience, and that will guide the way to wellness. Okay, so those were the findings of the qualitative study. The next is to talk about the fruit of the integrative treatment approach. And basically, to create the integrative treatment approach, I took the contemplative psychotherapy principles and I took the qualitative study findings and I added a little special sauce and I mashed them up and I said, how can we fit all of these things together into something that can work? So again, this is a sketch of a treatment approach. It merits more development in order before it can be deployed and taught to people. But I think these things fit together pretty well. So let's take a look. And then, showing this image of a loom and a shuttle, I think that the metaphor of weaving is really good both for this kind of integrative treatment approach of bringing together two strands of understanding and building something new. And weaving is also a really powerful metaphor for the experience of recovery and integration that participants reported as a part of the study. That by using the shuttle of present moment mindful awareness to bring the thread of experience back and forth along the weft, or rather along the warp of time and situations, it becomes possible to create a life that is made of a whole cloth. So it's both emblematic of the recovery process of using mindfulness in this way, and it's also emblematic of how to bring these different research approaches together to create a new thing. So this is the materials list for an initial sketch, or kind of the table of contents for this little section. And again, kind of the key principle in terms of my findings, and maybe the biggest surprise to me, is this notion of integrating self and experience. When I had the matrix of wellness and I saw, oh, here's what's in the middle, what connects all these things, it's integrating self and experience. So helping people integrate and interconnect with themselves and with their experience seems to be like the most important thing. And there's a way that that's like a practical understanding of integrating self and experience. There's a way that it can rhyme with or partake of the Buddhist teachings on non-duality and reduction of creating artificial and unnecessary divisions, conceptual and experiential divisions between oneself and experience. And pragmatically, I think it just works. It comes out of these people's experience and they felt more connected and whole as people. And that process of integration is supported by the mindful capacities and effects that participants reported. Turning towards experience, embracing it, being willing to work with pain, and learning how to tolerate and work with emotions all enhance this overall process of integration of self and experience. And including other wellness practices is the second key point, I would say, of the integrative treatment approach. Is you integrate self and experience, and how do you do it? You have this whole suite of wellness practices that supports you in it. So this involves people trying things out, seeing how it works for them in different states of mind, finding out what their wellness practices are, and then shifting their wellness practice over time in response to emerging conditions. On one day, a person doesn't get a lot of sleep, so they're in a particular state and they need a different set of wellness practices than on a day when they're really well rested, but they have, a difficult emotional conversation to have in the afternoon or something like that. There are all of these different craft approaches to the specific techniques of using these wellness practices to create one's individualized approach to support. And as part of this, I want to mention that the mindful attitudes and capacities that people train in are developmental in that they change over time and build on each other. People become able to, for example, embrace more and more experience of their experience, but they're also situational in terms of matching up to different contexts, okay? And again, mindfulness practice informs and integrates the ability to skillfully choose which practice to use at a different point in time. Another really important point that came through in the qualitative findings was that participants had major turning points when, during their recoveries, they decided to take on their own wellness. So I think designing an intervention that teaches people that they get to choose what their particular goals are, their personal goals are for recovery, and then teaches them also that they have to take the reins, so to speak, of that process in order to be able to drive it and get the most benefit out of it. So a metaphor for this is kind of like deciding to embark on the journey of recovery. You look at the map of where you want to go, you start to make the plans, and then after you have the plans, you personally choose to go. Okay. And to follow with that metaphor of embarking on a journey, these key attitudes seem to me like compass points that guide the process of recovery. And what I found is that as participants learned to be able to embody a sense of commitment, gentleness, kindness, and discipline in their lives, they were increasingly able to work with their experience in a way that was skillful and appropriate, right? And I think discipline, for example, is often thought of as like a dirty word because it has a connotation of harshness or punishment. But in this case, discipline just means doing what's appropriate, like rather than doing something that's habitual or sloppy, just doing the thing that's just right, right? And doing it with the attitudes of gentleness and kindness, as well as a commitment for one's own wellness, can really be an expression of self-love and can heal the relationship between self and experience. And these were other things that came out in people's recovery narratives and in the responses they had to my questions. Another important way of contextualizing and conceptualizing mindfulness practice for the purposes of the integrative approach would be to draw on Dan Siegel's seminal field of interpersonal neurobiology, which looks at the relationship between human attachment emotional dynamics in the positive sense of attachment theory and our need for safe enough and meaningful loving connection between others, and looking at how mindfulness practice is actually a way to cultivate that kind of connection with ourselves. And so Dan Siegel talks about correlations between different brain regions that are activated during infant and primary caregiver attachment moments, and the same brain regions being activated in moments of mindfulness practice. And that indeed, the neuropsychological research and some neuroimaging studies appear to bear out the contention that mindfulness practice, as Dan Siegel puts it, being mindful is a way of becoming your own best friend, right? And so much of what the participants told me about during their interviews was how much they were able to learn to trust themselves and turn towards themselves and love themselves no matter what difficult state they were happening, to cultivate and experience that unconditional friendliness of Maitri practice, of the Maitri quality. And Dan Siegel is basically saying the same thing, just coming at it from a little bit of a different angle. So expanding on that and including some of those interpersonal neurobiology frameworks and practices could also be really helpful in terms of this integrative treatment approach. And then bringing some of those contemplative psychotherapy principles and speculating now on how they might be able to land for people in an integrative approach based on what participants told me as well. So the teaching on brilliant sanity, its implication is that people can develop and experience unconditional confidence that all states of mind are workable, right? The first title of my dissertation, All States of Mind Are Workable, is a really close parsing of something that a participant actually said to me in one of the interviews, that participant learned through meditation practice and through harrowing experiences of bipolar disorder. They actually learned that all states of mind are workable. And when you're able to have a deeply embodied and trusting experience that all states of mind are workable, bipolar disorder is much less scary and much less traumatizing because you gain the ability to work with different states from a regulated, empathic, and attuned place rather than being blown about by mood states. So the teaching on brilliant sanity is of immense import in terms of working with the experience of bipolar disorder. Another one that's really important is Maitri. I discussed this a little bit before, but just being able to cultivate unconditional confidence rather than getting caught in repetitive self-aggressive loops of trying to push away experience or turn away from experience or frighten oneself or hurt oneself about experience. You know, mindfulness practice and the Maitri attitude can be so powerful in reducing needless suffering and emotional reactions to oneself. The principle of exchange implies not only the ability to pick up on subtle emotional cues coming from other people outside and kind of like recalibrating and shifting one's nervous system state from one of activation to social engagement, but it also implies being able to look inwards and use interoception in order to be able to practice compassionate exchange with feelings, attitudes, and senses of self that are hurting in some way, and then being able to integrate that sense of self and bring it into connection and communication and loving embrace with oneself, and enhancing that internal attachment style. Buddhist frameworks, such as the 3 marks of existence, ultimate and relative truth, and compassion and altruism, participants all talked about using those 3 Buddhist frameworks in terms of working with the experience of bipolar disorder. And I think some of those ideas can really guide recovery and guide mindfulness practice and optimize it in terms of its recovery outcomes. And then finally, there are other contemplative psychotherapy perspectives that could really help to clarify mind and emotions and help people open up to shifts in perspective. The 6 realms, for example, can be a way of looking at the manic process or the process of cycling through moods and realizing, oh, I don't have to take this so seriously. This is just a cycle. And if I notice the exit points, I can step out of this at any time. It's not such a big deal. Things like that, I think, can be really helpful. And if I had the time, I could go on and on about those things, but I don't. So next slide. In terms of the integrative treatment approach, I would also like to add a few more frameworks that aren't as well represented in contemplative psychotherapy. This includes transpersonal lenses on acknowledging and working with the spiritual experiences that come with extreme states, giving them their due as potentially meaningful. I think the Buddhist and mindfulness-based approaches are really good in terms of not getting hung up on spiritual experiences. So letting them have meaning, but not kind of going all the way down the rabbit hole of overemphasizing such experiences, because that can lead to manic delusions and things like that, right? So they can have meaning. They could be an important part of paradigm shifts and spiritual personal growth, making space, but not getting lost in those things. And also humanistic psychology in terms of centering human experience and personhood and developing a fully fledged sense of oneself. I think, as I mentioned before, including recovery frameworks is important in terms of having alternatives to the disease discourse and making those alternatives be available to people in adaptive ways. And I think, too, it's really important to include contemporary trauma theory. There is a lot of research documenting correlations between traumatic experiences in childhood and subsequent diagnoses with bipolar disorder. So I think it's possible that for some people who end up getting a bipolar diagnosis, some of the underlying dynamics are related to unresolved trauma. And I think it would be really important in advancing this integrative treatment approach to include both trauma-based, to include frameworks and practices that can help to resolve unresolved trauma, as well as including explicitly trauma-informed mindfulness practices. David Treleaven's got a book out about that. A lot of that's happening a lot in people's like meditation communities, making sure that mindfulness practice is trauma-informed so it doesn't recapitulate things for people. And then finally, I would, I suggest that such a treatment approach should also include social justice and anti-oppression frameworks. Psychology has historically so emphasized the individual as being the locus of dysfunction and treatment. However, we live in societies or in a culture that has an unjust distribution of resources and lots of experiences of oppression and bias that happen every day. Those can give rise to problematic mental health concerns. And I think it's really important to help people shift the emphasis from, you're feeling bad, so we're going to treat you with Prozac, to like, oh, yeah, you're a racially oppressed person and your gender makes it so that people target you constantly. How can we give you more resilience in terms of dealing with that? And how can we build community experiences, structures, and practices so that that's not going to keep on happening to you, and then you'll feel better. I think those things are really important too. And then finally, I think that social justice can also be a pathway for people in suffering to express compassion and find meaning and purpose. For me, for a long time, this dissertation was a way of finding meaning and purpose in life when things were feeling kind of meaningless and purposeless. I wouldn't necessarily recommend it for everyone, but for me, it was a good way to expand and radiate my sense of compassion and wanting to help people. Okay, and then here we are nearing the end of the roadmap. I'm going to talk a little bit about future directions for this research and then give a summary where I just recap all the stuff. So this conclusion is like weaving together all the other stuff. So more weaving metaphors. I really like this one because it's colorful. And so basically, mindfulness seems to be beneficial for some people in terms of recovering from bipolar disorder. Especially mindfulness practice seems to enhance self-monitoring, the ability to know one's emotional state and one's needs in a given moment, and improve the coordination of recovery activities, which seems like a really important thing. You can have all the wellness practices in the world, but if you don't know which ones to use at a given point in time, it won't be that helpful. So I think mindfulness is really important for that, along with a whole bunch of other things. And Buddhist frameworks might enhance the impact of mindfulness practice in terms of shaping skillful behaviors, shaping emotions that are adaptive, and generating more, either generating more adaptive thoughts or generating a more adaptive relationship to thoughts. And multiple dimensions of recovery can help people understand their options, shape their own path and goals, and take responsibility for recovery. And people really need to build a whole suite of wellness practices and adapt them to what they need at a given point in time or a given chapter in their life. And it's really important for people to have skillful guidance and support around their recoveries. And that includes guidance around mindfulness practice, if that's something they choose to use, and around recovery and mental health concerns. So that can mean a combination of a mindfulness instructor who knows about mood states and trauma and clinical concerns. It can include a psychotherapist who knows about those things and knows a little bit about mindfulness. It can include some combination of those things. So it's really important to have a skillful support network, and then friends and colleagues and so on too. Those are the key takeaways. In terms of future directions, contemplative psychotherapy, I would call for more elaboration and publication, more and more of those things to have more dissemination and impact. Same with the qualitative findings. They need to be elaborated further, translated to clinical practice, and published. I might be able to publish more articles based on the qualitative findings. And then in terms of translating that to clinical practice, the output there is really this integrative treatment approach. So some possible future steps would be to elaborate the treatment approach and disseminate it to a wider audience. Obviously, a dissertation is a lot of work. It's been a lot of work to get this far. And then if I want to make more stuff come out of it, it's going to be more work. But hey, maybe people will help me. That would be really nice. Or maybe other people will carry this work along in terms of other steps along the way. And then finally, I would call for future quantitative and mixed methods validation of contemplative psychotherapy and integrated treatment. I think it's really important to be able to give people something that they believe in and that they feel is really helpful for them. That's my initial impulse in terms of creating this approach. And also it's important to verify and validate these contentions quantitatively to make sure that we're not just like replicating some kind of solipsistic misinformation, but that there's some quantitative data to back up the findings, and that people do indeed have an enhanced recovery experience from approaches like these. So this slide has all the references that I listed in the presentation. And then the last one is about how to get in touch. If you want to get in touch, please drop me a line. I'd be happy to hear from you. And that is what I did for my dissertation.